Hi, my name is Amy Sandifer, and today I'm going to be presenting to you a little bit of information about Cambodia. This was my country that I had to research for our global health course, and I'm excited to present a little bit of the findings about what I learned with Cambodian women and their prenatal care practices. So first I want to show you what my topic is, and it's prenatal care and incentivizing through vouchers, our voucher reward system, and empowerment. So I titled this slide, "If I Could Change the World," because I want to tell you about two Cambodias. One, the current Cambodia. So in the current Cambodia, what you see is poor prenatal care, lack of access to care, lack of finances to cover prenatal care, and a high maternal mortality rate. So all those equal just poor quality prenatal care within Cambodian women. However, if I could change the world,
I can change the world. I will be the sunlight in your universe. You would think my love was very something. Baby, if I could change the world.
I would aim for the future Cambodia. So what is the future Cambodia, you ask? Well, that's good because I have the answer. It's a Cambodia that provides high quality, accessible prenatal care and incentives for women who actually access and utilize the prenatal care services in Cambodia. So I'm going to present to you a little bit about the current health system within the Cambodian population when it comes to prenatal care. As you can see, it's very poor. In the current Cambodia, there's a lot of rural lands with a lot of rural dwellers, and they don't really have healthcare providers that come to provide prenatal cares, and they don't really have access to healthcare clinics. A lot of the patients, a lot of the women, if they do receive prenatal care, they do it sporadically and only on occasion, and it's usually by an untrained professional, which they're called healers within their, it's just traditional, in their traditional medical system. They also have a very fragmented healthcare system in Cambodia for a couple of reasons. One, they just have a very poor government structure. They don't put a lot into healthcare. The second reason is they've recently had a civil war, which actually destroyed the physical buildings, the healthcare clinics, so they don't even really have places to go and to deliver. Women are often seen as underserved and not as a priority. Obviously, just as within any low-income country, men are actually seen as superior and women are considered inferior, and they're not really provided or offered prenatal care or any type of medical care. The other thing, just as I was mentioning before, they don't have people who are highly trained. So there are a few physicians, a few midwives, but mostly patients are seen by just their village healers. When women deliver, the majority of women actually deliver at home with untrained traditional skill attendants, and so that's where you see a lot of the high mortality and morbidity rate among the women. However, the good news is the Cambodian Ministry of Health is really committing to improve maternal health and to reduce that maternal morbidity rate. So they are partnering with a lot of task force to try to find women, to try to train healthcare professionals to provide women access to care clinics and different things like that. So what is the health problem? Just like I was telling you, the high maternal and morbidity and mortality rate. So in the current Cambodia, the mortality rate, the maternal mortality rate in Cambodia is 206 per 100,000 women. And you may say, that doesn't sound like a lot. However, when you compare it to the United States, in 2015 there were only 13 to 100,000 women. So you can see quite a difference. 13 maternal mortalities versus 206. The second point is the prenatal care attendance among Cambodian women is very low. It's about 43%, and that's even more in the urban areas with the urban dwellers who actually have a better access to health care. Compared to in the United States, where the even in the poor areas, prenatal care appointment attendance is about 70%. Cambodian women, this is another point, they view health care, or they view prenatal care as health prevention. Health protection and not health promotion. So when they're pregnant, they view pregnancy, they don't see the need to attend prenatal care appointments on a regular basis. They don't believe in health promotion. They just see pregnancy as a state, and just if they go to the doctors, they go because they're sick, because they need health protection. Okay, however, in future Cambodia, what we're going to see is a reduction in the maternal mortality rate by increasing prenatal care access and increasing prenatal care attendance among the Cambodian women, and to improve the Millennium Developmental Goal number 5 to improve maternal health. So, what is the solution? How do we improve prenatal care among Cambodian women? So I definitely can change the world. And what is my solution? You ask, of course. To provide group-centered prenatal care with a voucher reward system for women who attend those prenatal care appointments. So group-centered prenatal care, what is that? Because now that's a new term you're putting out. Well, it makes sense. Group-centered prenatal care, just in a nutshell, is where a number of women attend one prenatal appointment with one healthcare provider. So one healthcare provider can see 12 women at one time and provide normal prenatal care of listening to heart tones, checking a patient's blood pressure, their weight, listening or measuring the fundal height, and also provide education at the same time, all in one visit. So what are the benefits of group-centered prenatal care? Well, you have education in a group setting, so women don't have to attend a separate appointment for a prenatal education program. They're also with other women within their culture, so they can learn from each other. They have support of other women around their community. Group-centered prenatal care, the goal of it is to encourage empowerment through women, so they're self-taught and they're taught how to feel or to notice when their baby's not moving, or to look for warning signs that may indicate their pregnancy is not going well. There might be some issues or troubles. And so women learn how to recognize those warning signs, and they feel a sense of empowerment because they know, especially in a culture where women are so inferior. Group-centered prenatal care requires less prenatal care appointments than if women were going to traditional prenatal care, because typically in traditional prenatal care, a woman sees a healthcare provider, just has blood pressure and weight done, and listen to the baby's heart tones, and then they leave, and then they have to come back for a separate appointment for just prenatal education and a little bit more than what's extended in a normal visit. But with group-centered prenatal care, women can do all that visit at one time. Patient receives both prenatal care and prenatal education, and the real benefit is there only has to be one provider per approximately 12 pregnant patients. So one trained provider that provides adequate care per 12 patients. So if you're in a village and you're in a community or a village with prenatal or with Cambodian women, and that provider can get to one village a day, then they can see all those women at one time. So you have to have less people available, or less trained providers available for the pregnant women. So The second part of my innovative solution is a voucher system. So at the completion of the group center prenatal care appointment, women would receive a voucher. And the vouchers are just a reward for their attendance. However, the vouchers can be used to pay for the prenatal care appointments and to pay for postnatal care and to pay for delivery. Because in the Cambodian population or the Cambodian communities, there are times when women have to pay fee for service for their delivery. And they may not have that, and that is partially why they call in unskilled providers to do their delivery. However, if they've saved these vouchers to pay for their delivery, that would be incentive for them to come to their prenatal care appointments. And it's proven to work. So this is not just grasping at an idea that hasn't been done before. It actually, back in 2014, Van de Poel did a voucher reward system within the Cambodian population, and it was proven it has shown that the women attended more prenatal care appointments, and their maternal mortality rate had decreased. So what are the goals of group center prenatal care with a reward system? To increase the number of prenatal care visits attended, to improve pregnancy outcomes, to reduce the maternal mortality rate, to improve upon the Millennium Developmental Goal number 5 of improving maternal health, and to empower, educate, and support the Cambodian women. And it's a financial solution. It helps them assist in prenatal care costs, transportation, costs with the delivery, and even some family costs, since women are not having to, or the families aren't having to take extra money to pay for prenatal care. They actually can just put that money back into their family system. So the future healthcare system, so I talked about the current Cambodia. So what's in store for future Cambodia with this solution of incentivizing with voucher systems and group center prenatal care? No longer any current Cambodia, but the future Cambodia. The future Cambodia, women are seen as a priority. The maternal mortality rate is equal to that of a high-income country. Prenatal care attendance is equal to that of a high-income country. So, of course, the bright future begins here. Thank you for viewing my presentation, and I hope you feel inspired to change the world. Thank you.